Hello everyone, welcome back to my channel. This is Dr. Hajira and today I am going to talk about the lungs. The lungs are vital organs of respiration. Their main function is to oxygenate the blood by bringing inspired air into close relation with the venous blood in the pulmonary capillary. Healthy lungs in living people are normally light, spongy and soft and fully occupied by pulmonary cavities. They are also elastic in recoil to approximately 1/3 size when thoracic cavity is open. The lungs are separated from each other by mediastinum. Each lung has apex in the superior part and base in the inferior part. The apex is blunt superior end of the lung ascending above the level of first rib into the root of the neck. The apex is covered by cervical pleura. And then we have the base. The base is a concave inferior surface of the lung opposite to apex resting on and accommodating the ipsilateral dome of diaphragm. The lung consists of 2 or 3 lobes and 3 surfaces and 3 borders. As you can see in the picture, this is the right lung. The right lung features the right oblique and horizontal fissures that divide it into 3 lobes: the superior lobe, the middle lobe and the inferior lobe. The right lung is larger and heavier than the left lung, but it is shorter and wider because of the right dome of the diaphragm is higher, that which overlies the liver. And the heart and pericardium boils more to the left lung. And this picture shows the left lung. The left lung has a single left oblique fissure dividing it into 2 lobes, the superior lobe and the inferior lobe. The anterior border of the left lung has a deep cardiac notch. That notch primarily indents the anterior-inferior aspect of the superior lobe. This indentation often shapes the most inferior and anterior part of the superior lobe into a thin tongue-like process which is named as a lingula, which extends below the cardiac notch and slides in out of the costo-mediastinal races during the inspiration and expiration. The lung has 3 surfaces. One is the costal surface, second is the mediastinal, and third is the diaphragmatic surface. The costal surface is larger, smooth and convex. It is related to the costal pleura, which separates it from the ribs, costal cartilages and innermost intercostal muscle. The posterior part of the costal surface is related to the bodies of the thoracic vertebrae, and it is sometimes referred to as the vertebral part of the costal surface. And then we have the mediastinal surface. The mediastinal surface of the lung is concave because it is related to the middle mediastinum, which contains the pericardium and heart. The diaphragmatic surface of the lung, which is also a concave, forms the base of the lung, which rests on the dome of the diaphragm. The concavity is deeper in the right lung because of the higher position of the right dome, which overlies the liver. The diaphragmatic surface of lung, which is also a concave, forms the base of the lung, which rests on the dome of the diaphragm. The concavity is deeper in the right lung because of the higher position of the right dome, which overlies the liver. Laterally and posteriorly, the diaphragmatic surface is bounded by a thin sharp margin that projects into the costodiaphragmatic races of pleura. And then let's talk about the borders of the lungs. We have 3 borders. One is the anterior border, the second is the inferior, and also the posterior border. The anterior border is where the costal and mediastinal surface meet anteriorly and overlap the heart. The cardiac notch indents this border of the left lung. The posterior border of lung is where the costal and mediastinal surface meet. Posteriorly, it is broad and rounded and lies in the cavity at the side of the thoracic region of the vertebral column. This structure in the lung is called the hilum of the lung. The hilum of the lung is a wedge-shaped area on the mediastinal surface of each lung, through which the structure forming the root of the lung pass to enter or exit the lung. Subscribe to my channel to never miss my videos, so stay tuned for the next video.